the audience, I hope PG students as well as optometrists, maybe few surgeons, right? Okay. So this is slightly different in the what you all are expecting, optic and refraction majority for exams, module 3, but every year we are setting low vision questions also based on this lecture prepared based on last 10 years paper, easy for you all. At the same time, this is very important, extremely important. Actually now you all are going to be two things you are going to do this topic. One, you are going to pass the exam, that's correct, module 3, and after that you are going to work as an eye surgeons, whatever the field, right, subspecialty or whatever. So this topic is extremely important for you all, because I observed in our country there are certain things in clinical practice it's lack. At the same time, even if you consider optometrist, so that also for the exam, and you all have to pass the exam, and after that you all have to practice and you all have to work. So you all have to be very proud, because this is the only medical related field, ophthalmologist, eye surgeons. Those days when we were students, we just only came and study, should diagnose and treat, either do medicine or surgery things. But as an eye surgeons nowadays, you will have to work not only for this as well as for community also. You will have to engage with the community people and you will have to work. And the same time, now you all are transformed. This is the only profession transformed. You all are linked directly with the each and every country of sustainable development and sustainable development goals. Then you are going to not only with the medical related, you are going to work with education department, labor, social, and so many things. So this is the only part I hope gradually you will have to learn, because it's not basically not involved in your syllabus, most of the stuff, but basic parts is available. So I will touch only what based on what questions. Hope you all already read the questions, and in future and the current how you are going to work, even the surgeons and all. Right. So the definition, this is relatively different. So you go through generally everywhere in the clinics, and normally we won't use Lokma chart, and Snell and visual acuity chart is available, right? So this is the basic modern, the latest classification with the vision how you have to be differentiate into 4 group: normal, more than 618, normal or visual, no visual impairment based on this, 618 to 660 moderate, and there is a severe visual 660 to 3 by 60. Less than 3 by 60 seems to be blind. So here there is another classification, degree of visual impact. That means you are impaired on the severity of the this is actually the 3 grade, little detail on that. Here you can see normal, moderate visual impairment. You all are familiar on this, no? This Lokma and all. And there are 5 degree on this, 6 actually, and 3 groups are blind. One is normal and moderate visual impairment and severe visual impairment. I hope that's okay. If anything you can ask. So ultimately we have in 3 groups: normal vision, low vision and blind. So you know the disability, there are various disability: hearing, vision, mental, physical and all. So the vision, we have 2 groups, vision related disability, low vision as well as blind. That you should know. Next, this is your definition. You will get 20 marks, I think. Twice or thrice came, right? So there are 3 factors you have to be contribute to the vision, right? First, right, that's okay. Low vision is defined less than 618 to 3 by 60, that's correct. Or the visual field, less than 20. In the better eye, careful. If you can't understand, you let us, right? Better eye. We have two eyes, maybe one eye, a person, then better eye, right? With the best possible correction. What do you mean by best possible correction? After your treatment, either surgery or medicine or whatever you do, with the best possible correction, right? This is your ophthalmology, optics. This is the definition. But even with this vision, some people can do the task, some people can't do the task. If they can't do the task on this, then you will have to categorize it into blind, because it is a multiple disability. So that's why the consultant eye surgeon should see and confirm. Okay? Right. So then I have already mentioned vision only, we have two groups of disability, low vision and blind. Don't confuse these two terms inside, because even though the consultants, we have a problem, sometimes they may ask junior consultants, color blind is not disability. Okay? The definition is not included, no? Color blind, only for management only you need. Color blind at present is a very controversial topic, it's not disability. Why? Because of the definition it's not. But as you all practice, the surgeons, few surgeons, right, you all in future, sometime these all Air Force people, there are people, the task group, social task group, you should know the color vision is very important. Locomotive engineers, right, certain profession in the police department, certain profession in the military, almost all in the Air Force, like that certain, even medical profession, right, okay, certain things you need. So that's why the controversies are going on. So then you should know what test you have to do for the color vision and confirm it and give the certificate. That's different. But that's not disability. At the same time, the people will come in your clinic, busy clinic. Other problem is there, only eye. Sometimes you put, everywhere you put no only eye. Only eye mean you all know, but two eyes, better eye. Better eye less than 618, above 3 by 60 or with a visual field 20 degree, then you have to have normal or blind or no, low vision. Can you understand? So only eye, there are so many people will refer from the community and say only eye also may be the disability. No, only eye in our country, two purposes only you have to use. One, for compensation. You know, if any accident, one limb, there is a chart, 25% loss, 50% loss, you have to sign. That's the consultant duty. The second one, the only eye, in legally, for any university grant commission, university entrance, if you certified, they may consider for the special mark and all. Do you know that? Right? So you have to, these are the things you should know, because once you become a surgeon, generally the acting surgeon will be the trouble, because they are the ones suddenly put to the periphery, these things will come. Right, so make it and keep. So these are the two things you have to consider, only for any compensation purposes, whatever. The second part, if any student comes, you have to certify it and you have to give. So this is not disability. Can you understand? Correct. Don't confuse, because still there are a lot of confusion going on. Right. Then you can see the high health services. You all are going to work in a high health. So what are the services? Generally, we are almost always focused, spend billions of money for the curative, less in preventive. That's why we are at least now surviving. No one is interested in the rehabilitation. So other way around. If you have a good rehabilitation and preventive work, then the curative cost will be reduced. Now, you know, most of the time we don't have any drugs at all, no? We don't have any cataracts consumable. So these high health, any services, these three components, always you are led to think from medical student onwards. Then only comprehensively you will see all these things, especially for the exam. when I was an exam, you most of the time you are losing the marks, because if any case if you given, so you all just 3 trial your medicine and your surgery, medical, ophthalmology and surgery. None of the people will think, no, he is the breadwinner of the family, so I will consider this factor, because the vision is poor, I will refer to this patient to, then only you will get gold medal and pass. Sometimes you fail also, even in my exam. You talk all the things 20 minutes, none of the people didn't tell this patient vision is going to be less than 660. That's you mention, the exam candidates, right? I don't know which exam, maybe your previous one, right? Then what happened? The external examiner wants what you are going to do as a surgeon. No one answered. Only one candidate is got gold medal, right? Simple answer they didn't. Poor vision. You have to refer to the low vision clinic and the visual rehabilitation. So now itself you will have to learn in your case discussion, in your peer group review or whatever, right? Otherwise it won't come. Suddenly it won't come in the exam. Because in Sri Lanka, other countries okay, Western countries. So in the community, if you are here everywhere, if you take a bulk of community, people are normal vision, can you understand? Inclusive. Some are blind, they have equal rights, and some are low vision. Correct? So then you should know what is low vision, what is blind. Don't confuse anything. Right, so this is one question in your exam paper. I am the one on setting. Right, so what are the most common causes of low vision? Generally, I am the one setting this low vision question. And don't worry, you can pass, right? Okay. So uncorrected, so you have to write very nicely, right? Okay. So these are common sense, right? If you write refractory errors, no. In optic paper, uncorrected refractory error. Uncorrected refractory error, unoperated cataract. If you wear glass and cataract, then after that you are normal. Right? Don't make any mistakes, right? Okay? Then ARMD, glaucoma and all. Right? That's I think you all know, no? So no issue. So evaluation, this is the other question in low vision. These 6 topics we will always see. This is the only place you have to take history. So either way you can do. There are low vision clinics available, at least you all are trainees, no? Most of the time is tertiary cares everywhere is there. In Colombo, Jaffna, Karapitiya and Kandy. These are the tertiary cares, and certain other secondary units, that's anyway normally you won't go. Even optometry training also like that. So this is the only place you are asking the history. Visual acuity is important, that's okay, even LOCMA we will take. Color vision is important. Don't think then, don't confuse because of the color vision. No. Color vision, why? Because of your management purposes. Okay? So then visual field, gland contrast sensitivity assessment, anyway you are studying optics now, but don't forget this dominant eye. Most of the time the answer paper won't be there. So the management we are always thinking of that. Okay, dominant eye is important, no, that's obvious, no? Correct. Evaluation of the low vision. Now I am telling the evaluation of the low vision. So what are the causes for low vision or blind? Then evaluation of low vision. Blind already confirmed. There is nothing to evaluate, only the confirmation. So how do you manage any visual disability? So if any surgeons here, anywhere in your training center, good people will vanish from the clinic. The second part will goes to, I don't know here who are there, even the private also you can see in vision care. There are low vision and blind. In the low vision in Sri Lanka, we have only the low vision clinics. Here we do what we do, we try to counsel and do the environmental modification. Environmental modification. You have to, you see the old low vision clinic, the bright, now you see here, even I can't read now because it's a light, right? Okay. So it's very difficult. You all okay? For me it's difficult, right? Okay. Without glass I can't read because the luxicity is not enough luminance, like that. So you have to be the bright, correct spot, contrast, try to improve the contrast and all. So that's a environmental modification. All the models are available in all the low vision clinic. At least you go and see what is happening and all, right? Okay. And low vision aids. The low vision aids, your exam question, right? Blind people, if you confirm that, what you have to do, at present we don't have any eye clinics or whatever available here, only available in Kandy and Jaffna, certain extent. The blind people, 2 things you have to do, must. in Sri Lanka is a very primitive state, right? Like African country. White cane, okay, basic white cane mobility training, right? And braille. But in UK, if you go, there is no braille for the exam. But here up to university level, the braille is important, the braille. So you have to teach braille. Counseling is okay, everywhere is there. And white cane mobility. Once you get it, this braille and white cane mobility and all, after that, education, vocational training and self-employment. So these are the three components. It's easy for you all. If you can't understand, ask me. So this is important. Take this like this is for your exam answer. Right? Okay. So for the low vision aids, environmental modification, okay. That's depend on the environment you have to do. That's why we never going to ask. So suppose if you are in the Chandy house, this is different. If you are in a luxury apartment, modern, already they have everything. So you have to modify different. So that's individual. That you are letting with the experience, you will learn. This is important. Devices, types of low vision devices. Most of the time these questions are full marks for you all, right? Okay, you all will do very well. So optical devices, you all studied the optics, no? Increase the angle, point of angle of resolution, right? Okay, that's already you have done for near as well as distant. So you go through and see near, magnifying spectacles and magnifier. These are things you have to go at least see once. You go and see here, but most of the people are Colombo based training. Otherwise, you have to go and vision care, low vision clinic and go and see that, right? Because most of the time here is almost we don't have now. They have, they may, I told Dasanta also, you all can go, but he will come. You can go and see that one. So, and these are the common thing you all are writing, but non-optical devices also you all have to write, right? So, can you understand? Relatively larger size, larger prints. If you have a print, right now 8 fonts, make it 16. Anyone can read, no? 24, 36. There are people, right? Okay. So, that's a non-optical devices. This chart you all have, you can take it, right? I have given already. And other assisted devices is well established. Here also is there basically, but in other countries, it's a common one. I think CCTV is available here actually. You all go through and see closed circuit televisions. I will show the one by one pictures. Is it okay? Now low vision, environmental modification, right? That's 5 marks. After that, he will ask separately for this, right? Okay. You can see, you go through and see and just put and see also in your eyes, right? Telescopic, right? Okay. These eyes, this near one, this is actually, near one, these loops, right? Distant visions, anything according to the demand you can use it. So even the binocular one, dominant eye, right? Okay, then you can use one and you can write the answers, right? You can see in the schools also, if you are interested, you can go and see, right? Okay, this is sometimes you won't see, no? This is the magnifiers. These are all soft design, right? Increase the font size, non-optical, right? And this is that CCTV. Generally, we are giving for the university students at present. You all can see. You can increase the font and increase contrast, and it will talk also, right? Okay. Either way, it will go. So this is white cane mobility training. White cane mobility training. Why I have put this one? I am not going to train any blind person, right? So white cane, ideally the blind gentleman should train the blind student, right? So he is a blind actually, he is in my province. Subramanian sir, he is from Madavachi, he is a good aesthetic student, he is doing fine arts, western music, blind, right? Madavachi. So that's the way you have to train. So if you send to Sudharma or whoever now doing low vision, can't. There is a little bit of because you can't see. You can see, no? You can't see because the blind people concentration is entirely different from ours. So our 5 senses move here and there, and we are thinking in different also, right? Okay. This braille, have you seen this one, right? Okay. This is the alphabets, read and all. You can check your money also. There are things. The blind. This is the only currency. Even dollar is not available, right? At least these things you have to be proud, right? Yeah, everything is down, but these things, right? Okay. We are the top currencies, right? Okay. Right, the former president does this and all these things with Samansa and right. Samansa is the right. Braille and Braille printing. And you see there is a one. Can you see? In all the computers there, talk. If you put everything will read. Now even your phone can do, no? Excessive these things. You try and see, right? So printing, but here only problem we have, we don't have Sinhala and Tamil. So we have to transform it and get it. Once you confirm, you will have to practice like this, right? I hope here and the Kandi and Jaffna only. We have to give the certificate, it should be signed by the eye surgeon, right? Okay. Either the fellow low vision or irreversible blind. In addition, if school going children, even the university is not in the act, but that's why I told primitive, we have to give this letter. They have the privilege, 1 hour, 15 minutes like that. So this part is the one I mentioned for you all, right? This is little bit of your community and all sort of things. So in our Sri Lanka, everything we will sign very fast, right? Any agreement you and know whatever agreement, right? Okay. So you can see simply blind schools. You can't tell blind schools. It can be special training center or hostel for the blind students. That's why I told they have to be like here, inclusive. So disability inclusion practice, that's already we have signed. I don't know how many people are following that. So for that, you see in National Eye Hospital, we have preventive and curative little bit we are doing, preventive also health education, rehabilitation, low vision, blind and all, we have the network with other people. So then if you want the network, you have to be entered into the community based rehabilitation. That means various stakeholders, you should have link in your district when you are become eye surgeon or in the province. Okay. Community based rehabilitation. Then you should, it won't come for the exam, but as a surgeon for practice, right? Community based rehabilitation. I hope you are going to have the slide, you go through and see. This is the definition, right? How to be reduced and not. So why we have to do the community medicine? That's why our country also failed. You see, if you give a person with fish, one day you can eat. Now everyone, 80% of the population here getting samuti every day, free. Collapsed also, already collapsed. Again is going to be collapsed. But the other way around you have to do. That's the basis of community-based rehabilitation. You have to teach how to catch the fish. Then he can, till death he can do it. So this is not for your ophthalmology. This is the Bible word for our country also. Right, at present, right, okay. And this one, you will have to be very careful. This is, you will face any problem once you become a surgeon only, right, if you are handling patients and clients, right. This is called CBR matrix, right. For us, you see, I am now normal, most of here are normal, not any disability on the vision. You see, one example I will mention, you see, these are all legal, legal thing, WHO and Sri Lanka legal. We don't have lifelong learning. That's why we never learn, no? After MD, just with that knowledge, come and go and work, right? That's everywhere in the health sector, right? With the age, you will get the promotion without knowledge, right? Okay? So, but for disability people, this is important. The country or the government should provide lifelong. One example I have mentioned. So 5 into 5 matrix. So this is just for in your future you will have to practice this. Once you practice with all, then you can become a very popular person, right? Okay. CBI is very important. This is very important for community. But anyway, even someone said told to teach, and I hope sometime you may get 1 or 2 short question or something like that. Okay. This is just in Sri Lanka 2007. Father, you can tell father, Dr. Saman sir, now sir is retired. Now the Vision 2020 start these low vision things 2007. We have few centers, 12 centers. But as a normal thing, we start to give everything free. But now we can't give anything free because low vision provision. Now we have moved on to Insight 2030. So now it's included into the SDG program. That's why I just for a completion I mentioned. Devices, but we did here also same, you had goes and see public education devices. Now we are not giving because it's expense, but infrastructure is there, basic human resource development, only optometrists few are trained, and now no one is further training is not taking place as usual. Thank you very much. So if you have any question, you can email and ask. If you want now also you can ask. I will be here at the last, then you can ask at the last time also. So if any doubt you can take it, right? Okay, thank you.